West Florida Rehabilitation Institute is a 58-bed comprehensive acute inpatient facility in Pensacola, Florida, that is part of a larger campus including a 5-floor acute care hospital, behavioral health unit, full-service emergency room, ancillary building, and medical offices. The Rehabilitation Institute has earned the disease-specific certification for stroke through Joint Commission and is accredited for comprehensive inpatient rehabilitation and brain injury through the Center for Accreditation of Rehabilitation Facilities. West Florida Rehabilitation Institute is committed to providing comprehensive care through inpatient and outpatient services. The facility strives to be the hospital of choice for all of the Gulf Coast region and surrounding areas. All new hires not only complete a full week-long hospital orientation, but they also go through a full day of orientation on the unit before they even begin to be on the floor. It is during this time that all new hires are exposed to and see the West Florida Rehabilitation Institute mission and vision statements. There are several areas that the facility is focusing on for 2019. The facility cannot be better for the greater good without focusing on problem areas. The strategic plan for 2019 includes continuing to grow services, being the provider of choice, improving accessibility of services, and improving the quality of services. Finally, we will focus on exceeding customer expectations. We continue to grow services by going through our CARF certification this year and expanding the brain injury unit. Through this plan, we will implement a 8-bed neuroscience wing that will include TBI patients, traumatic and non-traumatic, and any stroke patients to be high functioning or low functioning. We do want to be the provider of choice for those types of patients coming into the Pensacola area. We will improve accessibility of services to build this program. We want to incorporate certified brain injury nurses that are going to go through CPI training and CSIP training, specializing in brain injury patient care. We will need funding to help the certification processes for all of the nurses and therapies. And we will also need funding to reconstruct the unit to make sure that we have all of the up-to-date equipment that will be needed for the brain injury patients. This will include netted beds for patient safety, low-boy beds with mats to be on the side, a WonderGuard system to help those patients that are impulsive, and bed alarms. We will continue to improve the quality of services by focusing on infection control measures that will decrease the CAUTI rate, CLABSI rate, and definitely decrease the fall rate. By doing that, we've put together several PI teams to focus on the reduction of CAUTI, CLABSI, and falls. The interdisciplinary team between nursing and therapy will focus on decreasing infection rates. By being the provider of choice and providing the certifications that we need for the staff, this will allow us to exceed customer expectations. We want to be the facility that brain injuries in this area will continue to choose time and time again. We hope that you will support us in developing the brain injury program and to move forward and to begin healing lives and getting patients back to a level of functionality to return to everyday life.